Hello everyone. So in this video we are going to talk about Mucor mycosis. Mycosis refers to a fungal infection and Mucor is the family of fungus that is causing this disease. The most common of the fungus is Rhizopus. The three important points to be noted about Mucormycosis is that this fungus is ubiquitous, that is, it is found everywhere. Right now, it can be present in your nasal mucosa too. The second thing is it is a life-threatening condition. About 50% of mortality have been seen in some cases. The third point being that it is an opportunistic mycosis. So not everyone having or harboring this fungus in the mucosa is going to develop mucormycosis. So let's talk about the risk factor leading to mucormycosis. So the first one is an impaired immune system. Now conditions which lead to an impaired immune system or decreased phagocytic action are one which are responsible most for the condition mucormycosis. One of the most common of them are diabetic patient who have an impaired glucose level or uncontrolled diabetes. The second thing is neutropenia or decreased WBC count, glucocorticoid treatment or the steroid treatment, making the person immunocompromised, hematopoietic stem cell treatment, and malignancy. Here treatment is done with immunosuppressive agent, again the same case, and HIV, which itself is an immunodeficiency syndrome. Another thing to note is that iron level and increased iron level in tissue as well as serum is something that is promoting the growth of this fungus. So people having an increased level of iron in the serum or tissue, like the patients with end-stage renal disease or someone who is in iron chelating agents like deferoxamine, are considered more susceptible for this disease. Deferoxamine here is also considered a fungal siderophore. Now siderophore is something that acts as an iron carrier, and here the deferoxamine is acting as an iron carrier for fungus, so considered fungal siderophore. Now let's try to understand why COVID-19 act as a risk factor for mucormycosis, or why we are seeing actually a large number of cases of mucormycosis developing in patients with COVID-19. And right now, actually in the second wave which is occurring in India, we are seeing more cases of this mucormycosis. Why this is so? So actually we know that COVID-19 is not only a disease that affects our lung, it is a systemic inflammatory disease. Okay, it involves our vessels. Also it causes decrease in our immunity. Okay, so it causes immunosuppression. Plus we are seeing that nowadays the steroid use has increased. So this steroid use is something that is more of kind of acting as a fuel on fire thing. Okay, so the steroid use for a long duration, okay, for more than 7 days, okay, people are taking steroids for a longer duration. Actually steroid itself causes hyperglycemia, so it makes the impairment of glucose level in your body, in the blood. Plus steroid itself act as an immunocompromising agent. Already COVID-19 was causing decreased immunity, so these all factors lead to increasing the chances of development of mucormycosis in a patient of COVID-19. Let's discuss further about types of mucormycosis. So actually we have 5 to 6 type of mucormycosis. The most important and most common one is rhino-orbitocerebral mucormycosis, ROCM. The second one is pulmonary mucormycosis, which is most common in patient who have taken an hematopoietic stem cell transplant. Cutaneous mucormycosis, the patient presents with ulceration. GIT mucormycosis, and a disseminated mucormycosis. Okay, so this was about the risk factors and the introduction to mucormycosis. Let's talk further about this. Now we will discuss about how a patient of mucormycosis presents and what is the management of this condition. So actually the first and the foremost thing we need to remember about this disease, and if only thing we need to remember about this disease, it is that this fungus is angioinvasive. Means this fungus is going to invade our vessels, and following the invasion it will cut off the blood supply, and this will lead to necrosis of the area being supplied by that blood vessel. Okay, and this is very rapid, very rapid. So generally the fungus enters the nasal mucosa, the sinuses mucosa, and it starts dividing, and then the symptoms start arising. So generally the area involved are the nose, nasal mucosa, the sinus, okay, through the lamina papracia. It pierces and enters our orbit. Through the cribriform plate, it also enters the cranial cavity involving the brain. Let's start with what happens in the nose and the sinuses. So patient will classically have pain, okay, in the cheek and the numbness around it. Plus he will present with fungal sinusitis, that is, he will have a nasal discharge which can also be bloody. As the disease spreads, okay, through the lamina papracia into the orbit, the patient can have involvement of eye, that can be in the form of conjunctivitis, redness of eye. He can have blurring of vision or proptosis. Plus, the angioinvasion can also cause palsy of all the muscle, extraocular muscle. So the patient can have ophthalmoplegia. Another important thing we need to notice is that the patient had proptosis in one eye. If the patient comes with proptosis in both eye, this can be an ominous sign. That is, there can be cavernous sinus thrombosis that has occurred, leading to bilateral proptosis in a patient which earlier had only unilateral proptosis. So these are some of the symptoms. Plus, as the fungus enters the cranial cavity involving the brain, this is something which the patient are presenting, generally, not generally, but most of the COVID patients are presenting in the emergency department with confusion and seizures. And when the patient present with such a condition, the case fatality rate is much higher than what is expected if he presents before. So these were some of the symptoms and signs seen in the condition mucormycosis. Okay, let's revise it quick. There was fungal sinusitis, involvement of eye caused conjunctivitis, blurring of vision, proptosis. Bilateral proptosis was an ominous sign. Also, the patient has facial pain, facial numbness, and eye pain. In the due to involvement of brain, there was convulsions and seizures. Now, initially there is erythema over the area involved, but this is for a very short duration of time. This fungus is so angioinvasive that the patient develops a black necrotic scar at the site of development of at the site of angioinvasion. As you are seeing in this image, you can note the black scar development over the area of orbit and the sinus, that is nose. Okay, this all occurred because of angioinvasion and necrosis of that area of the part that was supplied by that blood vessel. Now, diagnosis of this disease is made by CT and MRI. We observe for the black spots that are seen. Okay, the culture from the non-sterile site is also of value in this case, which can help in making a definitive diagnosis. Now, what is actually treatment of this diseases? We do surgical debridement of an area, plus we are using amphotericin B, that is 1 milligram per kg per day. We can use more better liposomal amphotericin B, that is 5 to 10 milligram per kg per day. Or third thing that we can use is amphotericin B lipid complexes. But actually the treatment of mucormycosis is not so cheap. Okay, there are around the cost of single injection of amphotericin or liposomal amphotericin B is around 3,500 rupees. So the actual cost that goes for around 6 to 8, sorry, for 14 days can be lot more. Okay, so this is not so cheap of treatment. So these are the something you need to know about mucormycosis. Thanks for watching.